like to remind Dr. Sajid Sheikh to come on the stage.
Thank you very much. Worthy Principal, Professor and my dear colleagues. I need to have little to talk about surgery after Professor who is my teacher, and he's here when he talked about the surgery. And remember that I'm a surgeon and I'm his student. You can see that how important this specialty is, that one after the other the surgeon came on the scene. Now, next slide please. Surgery is perhaps the best combination of these three things, the triad of knowledge, skill and attitude. You don't see in many other specialities all these things together, but if you don't have adequate knowledge, skill or attitude, you can't be a very good surgeon. There are different surgical specialties. Still we have other surgeons to come, and Dr. Sajid will talk about urology and its specialities. But briefly, after general surgery, there are many further specialities. The most now becoming specialty is the laparoscopic surgery. And with reference to the scope, I will say that there is no scope without scope. That is, in future, the scope is that of the endoscopic surgery, laparoscopic surgery, urology, whatever it is. Then the breast surgery, the colorectal surgery, upper GI surgery. Now with the increase in road traffic accidents, we need the trauma surgeons also. And then endocrine surgery, special endocrine surgeons, bariatric surgery, transplant surgery, and now coming to this robotic surgery. Orthopedic surgeons like the spine surgery, reconstructive surgery, hand surgery, trauma surgery, these are also the specialities of surgery. You see, we have a neurosurgeon here sitting, urologist, plastic surgeon, the cardiac surgeon, and thoracic surgeon. Now, just have a look. Being a surgeon work long, often irregular, and for unpredictable hours. Their work requires a high level of focus, and the consequences of any error can be great. But yet being a surgeon can be extremely rewarding work for the right time of a person. Now, as Dr. Riaz said, I, in my career, never saw any disadvantage of being a surgeon. I can't see any disadvantage of being a surgeon. So I'm here to invite all of you to become surgeons. Now, what a surgeon can do? It can improve the patient's health, whether they are repairing organs, saving limbs, or removing malignant growths. Surgeon can dramatically improve patient's life. Many surgeons, they come to work out of drive to help the people. They are the leaders, and they become the leaders when they are in operation theatre. So the good leadership and teamwork are both essential in an operating room. Leading a surgical team through a difficult procedure and finishing it successfully can be very rewarding for a surgeon. So do you want to be surgeons? More to say. Alright. You can have the professional development and growth after being a surgeon. Throughout their careers, surgeons continue to learn about the latest medical research and surgical techniques. If you don't change with the time, if you don't grow with the time, you are dead. So this is what we believe. Every surgeon, they have to learn with the passage of time. New techniques come day and day, and you have to learn all these techniques. By attending conferences, reading medical journals, and consulting with other surgeons. Many surgeons enjoy having a career where they never stop learning. So do you want to stop learning? No. So you want to be surgeons. So this is another important aspect of being a surgeon, that you have to take the critical decisions, because surgeons many times are not sure what they will find once they start procedure. Especially when you receive patients with trauma, like patients with blunt injury abdomen, you open the abdomen and many a times you see many viscera damage at the same time. So you have to take the chiropractic decision. So they have to make decision quickly and adapt as a necessity once the procedure is underway. This can be very challenging, but also ultimately very rewarding also. Now, how to become a surgeon? You all know in Pakistan we have FCPS and Master of Surgery. For FCPS you have to do the part 1, then you appear in intermediate module, and part 2 it takes care about 4 to 5 years according to the different specialities. In UK there is an RCS, then FRCS, and USA there is an American board. So you want to be a surgeon or not? So when you will work as a house officer, you will find out that long hours on surgery pass more quickly than short hours on other clerkships. You will appreciate the operating room teamwork during a difficult operation when the nurses, anesthesia and surgical teams all are put together to save the life of the patient. And you will also enjoy watching your patient improve daily after major injuries or surgical procedure. This is very rewarding, I tell you. Then you will feel intrigued by the challenges of managing multiple physiological and psychological problems in your critically ill surgical patient. And notice the excitement of your surgical team anticipating a great case. If all these things you feel and you have learned during the internship, then yes, you can opt the surgeon as a career. Now, surgeons are trained, not born. Learn this thing. We used to say that surgeons are born surgeons, not at all. There is no way to prove you are born surgeon. Intelligence, consciousness, creativity, courage, and perseverance on behalf of your patient are the critical factors, and they outweigh the small differences in dexterity among most medical students. So becoming a good surgeon is a lifelong process. Remember, still you want to be surgeons? Alright. So thoughtful reflection on the outcome of your decision and those of others will gradually give you the most important quality, that is good surgical judgment. Also, being a nice is as helpful as it would be for any physician. Your patient, your colleagues and other healthcare workers will all deserve your respect and compassion. So does that mean that any medical student can become a surgeon? Well, not at all. Good mental and physical health are necessary. When I was training, one of my teachers, he used to say that the surgeons, they use hand, not head. But this is not true, I tell you. You have to use both the brain as well as your hands. The most diligent students may be able to gain a spot in the surgery, but not all students will be happy with the surgical career. So you have to be careful when you choose a career as a surgeon. First and foremost, you must thrive on being part of surgical enterprise, and you must absolutely look forward to opportunities to go to the operating room. Additionally, you must be flexible. So if you have these qualities, you can be a surgeon. A surgeon's day is seldom predictable, and surgeon must view this unpredictably as an enjoyable challenge. Your family may not enjoy that because in the middle of the night you may have a call from your hospital for an emergency, but this is what is enjoying when your patient is healed by your hands. Why is that some of medical students just hate being in the operating room while some find it exhilarating? You are not one of the students who hate being in the operating room. Being comfortable as a surgeon also means being comfortable accepting the responsibility of a role as a leader of the team. Motivating the team and facilitating their best efforts are skills you can learn in your surgeon training program, but at the core, surgeons must be able to accept the responsibility. Surgical culture is one of the continuous improvement. So students who are uncomfortable making quick decisions. Now, this is the point. Those who are unable to make quick decisions with incomplete data, occupying position of leadership, or discussing errors in public forum may be uncomfortable in surgical rooms. So they shouldn't be surgeons. If you are still not sure if surgery is right for you or not, then surgeons are people who find it extremely rewarding to act and see the impact of their action on behalf of their patients. Chances are the satisfaction you derive from their surgical career will be an energizing force that will not only carry you through the training process, it will be a benefit to those who are important in your personal life as well. So, thank you very much.
And press lecture on surgery.